Hi, this is Team Ichi's Health Professional Practice 2 seminar presentation.
Question. During an intervention with another senior therapist, an adverse event occurs to your patient. Using Pitello's 6 steps, please present an online seminar presentation of what you would do.
You and the senior therapist collect Mr. Claus from his room. Upon collecting Mr. Claus, neither you or the senior therapist checked his medical record chart. Problem. Mr. Claus had recently taken a sedative which you are now unaware of. Whilst the senior therapist was pushing Mr. Claus, she bumped the wall, causing Mr. Claus to fall forward and graze his knee. Your initial impression is that the senior therapist will not report this incident.
As previously mentioned, we'll be using Pitello's 6-step process to decide how to progress with this situation.
The first step is to gather all the relevant information. Upon discussing the event with the patient and the senior therapist, you find that the patient expects an apology but does not particularly want to cause a fuss. The senior therapist does not appear to have an intent to report the incident, but does agree that he or she will apologise. An objective examination of the patient shows no signs of permanent damage or anything to suggest a concussion. This event fulfills the criteria for a fall as the patient inadvertently and unintentionally came to the floor from an upright position. A fall during treatment would meet the criteria for an adverse event as something that causes distress or duress to the patient occurred during a treatment. The National Accrediting Boards for Physiotherapy and Occupational Therapy both have a policy of open disclosure. There must be full disclosure of the event to the patient as well as why the event occurred. Adverse events must also be reported to the organisation, i.e. the hospital in this case, and there must be an element of remorse for the adverse event, and that must be communicated to the patient.
Step 2. Identify the type of ethical problem. The ethical problem in this scenario is how best to care for the patient, do the right thing according to policies of the workplace, and also show care and concern for the senior therapist who showed reluctance to report the adverse event. All health professionals are moral agents in that they have a responsibility to act in a way that protects the moral values of others' aspects of morality.
The new grad feels moral distress due to the senior therapist's plea not to report in fear of the consequences for reporting her. She's also facing an ethical dilemma. She needs to choose a course of action from conflicting options. Should she honour the senior therapist's request not to report? Will this result in harm or good? Should she report the incident in open disclosure? When there is confusion as to who is in charge, locus of authority comes into question. However, both you and the senior therapist are responsible for the client's duty of care. An appeal to the policies or another senior therapist may resolve this conflict.
The ethical principles in this scenario include non-maleficence, beneficence, principles of veracity, and principles of fidelity.
Step 3. Use ethics theories to analyse the problem. Is there a right or wrong decision, or a right or wrong way of analysing a situation to come to a decision? Ethics theories are one tool which can be used by health professionals to guide them through the decision-making process. Two types of ethical theories are teleological and deontological, each providing you with different ways of analysing an ethical situation. Teleological focuses on the outcome of the situation to determine the action to be taken. As a moral agent, we must consider what several different courses of action could accomplish, the goal being to fit the action to the outcome that brings about the most good or least harm overall, with all things considered. For Mr. Claus, the new graduate should consider all options which are presented in Step 4 and decide on the action which results in the most optimal outcome and the least harm. Deontological focuses on a person's duties and rights as a measuring tool for action. Furthermore, that the outcome of the situation or the result of the action should not influence the decision-making process. For Mr. Claus, the new graduate should act according to their duties as a health professional, i.e. the professional code of conduct. Therefore, the new graduate's primary duty of care is to the client and thus should investigate an open disclosure procedure by reporting the incident.
Step 4. Explore the practical alternatives. In this step, options have been identified for the junior therapist and their possible outcomes. Option A. Cover the actions of the supervisor by not reporting the error. Outcome. The ethical and professional integrity of both therapists will be at stake, breaking national and state legislation, breaching codes of conduct and not fulfilling their duty of care. This can lead to losing their job and or losing their license to continue practicing. A health professional has a duty of care to act responsibly at all times, even if a supervisor directs otherwise. It is a breach of the health records and its relevant amendments not to pass on clinical information. Option B, consult with the supervisor. Remind the supervisor that both therapists' ethical and professional integrity will be at stake and that they both will be breaking national law and legislation and breaching codes of conduct and duty of care. The standards of practice for ACD allied health professionals state a supervisor working in a management role should use their position fairly and appropriately. Negative outcomes to option B. The senior therapist may feel affronted by the new graduate in this situation. This outcome may be similar to option A if the supervisor doesn't agree. But the positives. The senior therapist may apologise and agree to follow an open disclosure process. In this process, therapists will be able to express regret. The patient will be kept informed. Feedback will be provided on the investigations as to how and why the event occurred, and steps will be taken to prevent the incident from occurring again. This outcome will enable systems of care to be changed to improve patient-client safety. Both therapists involved will be deemed to have had a caring response. Option C. If the supervisor doesn't agree to participate in option B, option C will be followed despite the supervisor's decision. Option C is to follow an open disclosure process by going over the head of the supervisor. For our scenario, the most practical alternative to follow is option B.
The correct course of action is the use of open disclosure as displayed on the following flowchart. A lower level response is triggered given that there is no permanent injury, there was only a minor abrasion with no ongoing medical issues, no increased level of care, for example a transfer to another ward or ICU was not required, and no or minor psychological or emotional distress. A detailed description of the initial event, as well as any discussions with the patient and other medical staff, must be documented as soon as practicable in the patient's file. This should occur even if this contradicts what the senior therapist has documented, or if you don't usually complete the notes for this patient. Further, relevant authorities need to be notified. This may include another senior occupational physiotherapist or the manager of allied health. This will lead to a review/investigation of the incident. An initial discussion with the patient is also required. An acknowledgement that the incident occurred, an apology, explanation, as well as an agreement on closure will need to be discussed. Ideally, both you and the senior therapist apologise. The patient should be encouraged to give their version of the event as well as how the event has affected them. It would seem that an agreement on closure can be reached with the patient, as he has previously stated that he wants the therapist to be more careful in future and that an apology would be nice. Pertinent information from this discussion will be communicated to the primary healthcare providers. All documentation will be filed and provided to the patient. The patient and staff should be surveyed to assist with improving the open disclosure process in the future. Actions to prevent future events should be implemented. In this case, these may include further training of staff, for example on safe speeds, operated wheelchair and use of wheelchairs. An in-service on the importance of ethics for health professionals should be completed, and posters explaining the correct procedure for reporting adverse events should be placed around the organisation.
Reflecting on this situation and its outcomes will help to determine if an ethical outcome was reached. Professionals must communicate, collaborate, and negotiate across professional boundaries to ensure delivery of care. Therefore, the transparency and professional communication has allowed the team to use best care practices by reporting the incident and investigating ways to eliminate the adverse event from occurring in the future. This outcome resulted in patient satisfaction with the care that had been provided, and the healthcare team have begun to work on some educational tools and interventions around reducing the risk of injuries in the future. The most challenging aspect of this situation was confronting the senior therapist due to the interprofessional conflict that it created. The new graduate had the potential of ruining a relationship with a senior therapist. However, the supervisor had been in agreement and it did not negatively affect the outcome. By reflecting on this process, the team can use this experience to prevent this situation from occurring in the future. Education around the responsibilities of the allied healthcare team to report incidents should be implemented into the workplace. Workers should have a team discussion with their manager to work out how to reduce the amount of work had per day or increase the amount of staff available to complete tasks. This will assist the team in avoiding situations where one is too busy to look over a patient's most recent chart. Lastly, it will be important to conduct a thorough risk assessment. I'm going to end on this quote which inspired our presentation. Effective teams are grounded in a shared purpose to support the common good in healthcare, which is not what is best for a singular practitioner, but rather what is best for the patient.